All right, so when you want to treat someone with knee pain, of course you want to do the whole leg, all right, as we talked about throughout the course. You're going to, because it's a bony structure that it can be a little bit tough to do cupping on, but as long as you use a small cup. Now, if the person can flex their leg, it will make it easier access, but problem with a lot of knee pain is the person can't get it flexed, or you can't flex it very much. But if you can get a pain-free area of flexion as opposed to just, extend it like this, it will make it easier for you. So a small cup works well. I'll show you. So just think, we've done all of the thighs, the hamstrings, lower leg, that sort of thing. So I'll just show you here. And you want to go over the top of the patella here, the kneecap, and all around. So you simply go all around the knee, down onto the patella tendon here, and coming up, because the quadriceps muscles come to the kneecap and go above it, around it, and underneath it. So you really want to work all of this area. Of course, down to your medial ligaments here, as you can see, along them. So you've got your medial collateral ligament in here, you've got your joint line, you'll work all of that area. Now I'll show you with, keep yourself modest there, so I'll show you with what happens when we get up to here. So you see, I can get a bit more suction there. So I'll come back around, across it, so you can see if you can get into flexion, it really does make it just that bit easier. I mean, nothing is a major problem. So as I say, work your way down around. Don't work into the popliteal fossa there, the back of the knee. Stay out of there, but you can certainly work up to the calf to there, along the hamstrings there. And you do both sides, of course, of the knee. Come down here, see if you can get a better angle there. But I'm just doing the opposite on this side of the knee. So we're really working all of these fascial restrictions, new trigger points. So that's it. You work your way around there, all around the knee, and that's how you do cupping for the knee.